Is shoulder surgery worth it? Hey there, I'm Dr. Jeff Williams with Creekstone Integrated Care here in Amarillo, Texas, coming to you with a new video this week covering the topic of shoulder surgery and whether it makes sense in almost any case at all, really. First though, just stop and try to say shoulder surgery 3 times real fast. See how it works out for you, okay? The question of whether or not a person truly needs surgery, that's a tough one to answer, right? Mostly because every patient is different. Every patient heals differently, and every injury is different as well. However, we don't have to answer the question from an opinion-based perspective. We can answer the question based on research. There are lots of interesting studies that we could talk about, but I really want to narrow it down and just pick out 4 in particular that are going to help us really frame our discussion correctly. Now, one will show you that 75% of full thickness tears in your shoulder can be rehabilitated without the use of surgery. The next one is going to show you that there is no difference between those that had rotator cuff repair versus those that had no surgery at all. The third one will back up the second paper, and it's going to bolster those findings. And the last one will show you how the research shows the most common surgeries that are done on patients for musculoskeletal complaints like shoulder surgery have no firm basis in the research and are unfavorable ultimately to having surgery. Now those are big claims, right? Luckily I get to stand on the shoulders of big, huge research people. It's not me. It's not opinion-based. So hear me out here. I want to start by saying I am not against surgery. Some patients absolutely need it if they're going to have any kind of quality of life. And I go to medical doctors when I'm sick for my checkups and all of that good stuff. I work with those in the medical field as part of an integrated team. Lots in the medical field are my personal friends. But what I am absolutely against is unnecessary surgery, suffering, recovery, and certainly repeated surgery when it could all have been avoided in the first place. Repeated surgery is much more common than you would hope that it would be. Surgery is permanent if it can be avoided at all through non-pharmaceutical exercise rehabilitation. Why wouldn't you do that? People hurt their shoulders in an endless variety of ways. We have almost unlimited range of motion in our shoulders, but that increased mobility comes at a price because it makes it more fragile. From just working out with bad posture to actually having a traumatic fall, like we like to laugh at on social media, those falls, yeah, well, they have consequences. And it's time like these that chiropractors come in handy, right? But let's look at the idea of rehabilitation over surgery, okay? Exercise rehab over getting surgery. A research paper in 2018, just 2 years ago, published in the Journal of Shoulder and Elbow Surgery, not a chiropractic journal, folks. They wanted to find out what happens to shoulders 5 years later if they simply didn't have the surgery at all for the shoulders that would have been deemed surgical. And these patients all had full thickness tears in the rotator cuff, and they had been hurting for well over 3 months. They had these patients undergo a non-surgical, home-based exercise treatment program, and then they followed up with them regularly. Now listen closely here. At the 5-year mark, approximately 75%, 3/4 of the group, 75% of the patients remained successfully treated with non-surgical treatment, and they enjoyed a quality of life score of 83 out of 100. So the conclusion for this paper was the operative and the non-operative groups at the 5-year follow-up were really no different. Next paper. Let's look at having surgery for new shoulder tears, okay? In this second paper, the researchers wanted to compare early surgery with no surgery for a traumatic rotator cuff tear. This was what is called a randomized controlled trial, which is really high-level research. This was also in the Journal of Shoulder and Elbow Surgery. Now, again, not a chiropractic journal, okay? One group of patients had surgery while the other had exercises prescribed. Now, before I get to the results, I want to point out real quickly that 6.5% of the surgically repaired shoulders tore again. The findings of the paper were, quote, "We found no significant differences in clinical outcomes between rotator cuff repair and non-operative treatment at the 12-month follow-up." So 1 year later, there was no difference between those who had surgery and those who did not have surgery. Moving on, for our third of the 4 papers we're going to discuss here, let's look at rotator cuff repair versus no repair. This one is very reliable, very high-level research, and it's an important paper that was in the Cochrane database of systematic reviews. Also, not a chiropractic publication at all. Just last year, this came out in 2019. They compared the benefits and the risks of rotator cuff repair. The research concluded, quote, "Surgery may provide little or no clinically important benefits for pain, function, overall quality of life, or participant-rated global assessment of treatment success when you compare it to non-operative treatment." There's no difference between those having surgery and those not having surgery. See what I'm getting at here? And finally, we need to talk about how the most common musculoskeletal surgeries performed on people are not adequately researched, at least not like you would hope that they would be. Now, this one actually took my breath away a little bit when I first saw it, and it may do the same with you. It came out in Pain Journal in 2020. Again, this is not a chiropractic journal, and you're seeing that trend on purpose. If I just echo chiropractic papers to you, it means nothing. But if I cite and quote research that comes from, big, respected journals, well, then I think it means a little more. The goal here was simply to find out how many of the most common musculoskeletal surgeries have been adequately researched. And what they found was, to me, disturbing. This paper was done to demonstrate that observational evidence, meaning just kind of what I see, what I observe, to demonstrate that observational evidence is not enough when you consider the costs and risks of having to undergo surgery. Observational study, like I said, it means they take a look at you and they think, yeah, they seem, I think they did good, That's observation, but it's not research. They say surgical procedures that should undergo randomized controlled trials with blinding and showing statistical and clinically important symptomatic improvement when compared to no surgery at all. That's the way the research for these things should be done. And wouldn't you expect that they already did this? Apparently, they have not. They selected 6,735 research papers on these surgeries. Surgeries that ranged from shoulder surgeries, like we've been talking about, shoulder surgeries of all kinds, to knee replacement, carpal tunnel surgery, hip replacement, low back fusions, and more. Lots of stuff like that. The most common musculoskeletal surgeries. Now, what they found was of those 6,735 studies, only 64 of them, which is less than 1%, ever even compared having the surgeries to not having them at all. Less than 1%. And of those 64 studies that actually compared surgery to having no surgery, only 9 of those were actually favorable to having the surgery. 9. Woo! They say, quote, "We conclude that many common surgical procedures performed for musculoskeletal conditions causing chronic pain have not been subjected to randomized trials comparing them to not performing the procedure, based on the observation that when such studies have been performed, only 14% on average showed a statistically significant and clinically important benefit to surgery. There is a need to produce such high-quality evidence to determine the effectiveness of many common surgical procedures. Furthermore, the production of high-quality evidence should be a requirement before widespread implementation, funding, or professional acceptance of such procedures, rather than the current practice of either performing trials after procedures have become commonplace or not performing comparative trials at all. In conclusion, I would have to say that the experts have shown many different ways that most probably don't need surgery and can be successfully rehabilitated without surgery. And not only that, but when surgery is done, there is typically no real difference between those that went through the surgery and those that did not. As an exclamation mark to the discussion here, the most common surgeries for musculoskeletal conditions have no high-quality research proving that they even work compared to not having the surgery in the first place. So, in my opinion, if a patient is looking at having shoulder surgery, they should be finding an evidence-based, patient-centered chiropractor and or an evidence-based, patient-centered physical therapist. Not all chiropractors and PTs are created equally, folks. And just because you may have gone to one and didn't really get relief, it doesn't mean that chiropractic is not right for you or can't help you. Okay, sometimes you just need to keep looking until you find one that knows what they're doing. That's all. Because in the end, we really are your best chance at getting over it and getting back to your life. And not only that, but we can do that non-surgically, non-pharmacologically, no pills and shots, and we can do it safely and we can do it smartly. Again, I'm Dr. Jeff Williams with Creekstone Integrated Care here in Amarillo, Texas. If you're from the area or you're going to be traveling through and you need to be seen, call us. The number is 806-355-3000. Let's get you on the schedule. If you're watching this on YouTube, hit that subscribe button to keep from missing these weekly fact-filled videos. If you're watching on Facebook, hit that like button and then share this video with your network. I promise you someone on your friends list is looking at having shoulder surgery. It's extremely common, and that's a guarantee to you. So help them out, won't you? Share this video. Until next week, be safe, stay healthy, and be kind.